I'll be discussing social welfare policy, and these are some questions, 5 questions I'll be discussing about social welfare policy. Discuss the meaning and scope of social welfare, state its significance as an academic specialty or a profession. So I'll be going down to one directly. One, uh, to be able to discuss the meaning and scope of social welfare. The meaning of social welfare appears to organize efforts by the government, society, institutions to ensure the well-being and quality of life of individuals and families and communities. It encompasses a range of policies, programs, and services designed to protect and promote human health, one, economic security, two, education, and social inclusion. The aim is to provide support for vulnerable populations, including the poor, elderly, disabled, unemployed, and marginalized group. So that is the meaning of social welfare. Now, talking about the scope of social welfare, the scope of social welfare is very broad. It touches various aspects of the society aimed at improving people's living condition. This includes economic welfare, provision of financial support through social security programs, pensions, unemployment benefit, and poverty alleviation. A good example is the conditional cash transfer program in Nigeria, where funds are provided to poor families to improve children's health and education. We also look at health services, ensuring that access to health for vulnerable populations, including free medical care, immunization, and public health education. Example, Nigerian Health Insurance Scheme, which aims to provide affordable healthcare access. We're moving down to education. So that's the scope of social welfare. It's very broad. So we've talked about one, economic, two, we've talked about health, education, skill, education, three, which is and skill development, scholarship, free education programs, and skill acquisition initiative for underprivileged individuals. Going here, we have examples of universal basic education, UB, which provide free primary education to reduce illiteracy. And we have housing and shelter, affordable housing programs for low income earners to improve living standard. Nigerian government, for example, helps families with a home fund initiative provide affordable housing loan. Now we go down to employment programs. These are the scope. Number five, employment program. Policies for job creation, employment, and skill. Social justice inclusion, protection of rights of marginalized group, including gender equality, children's rights, and disability support. So in summary, social welfare addresses poverty, inequality, unemployment, health, education to create fairer and more inclusive society. So when you are asked what is the meaning of social welfare, you know that social welfare is organized effort by the society, government, institutions, which can be states and non-states, to ensure that the well-being and quality of life of individuals and families and communities. So ensure it encompasses a range of policies, programs, services designed to protect and promote human health, economic security, education, social inclusion, which are the scope. The aim is to provide support for vulnerable population, poor, elderly, disabled, unemployed, and marginalized group. So under the scope here, we have economic welfare, we have health services, we have education and skill development, we have housing, we have an employment program, and lastly, we have social justice and inclusion. Okay, so B, state the significance, state its significance as an academic specialty or profession. As an academic specialty, social welfare is an academic specialty which equips students with theoretical knowledge and research skill and critical thinking abilities to address social problem. It's interdisciplinary in nature. It's interdisciplinary in nature. It draws from sociology, psychology, public policy, and economics. Significance in research policy development. Academics in social welfare conduct uh, research to identify social challenges, evaluate existing problems, and propose evidence-based solution. Understanding social inequality. It helps scholars study poverty, unemployment, and health disparities and inequality to create actionable policies. Training for public service provides expertise and experts who are equipped to work as social workers, policy analysts, and public health professionals. As a profession, the first one was as an academic specialty. As a profession, social work, social welfare is a professional field focused on addressing human needs, enhancing individual community well-being. A profession, its professional significance include policy development and implementation. So social workers contribute to development, implementation, and monitoring policies. Examples are professional working in Nigerian Social Investment Program (SIP), advocacy for vulnerable group, professional advocates for rights and welfare, like NGOs advocating for women rights and children welfare. We also have direct service delivery as social workers provide counseling, health care access, shelter, and educational services, and capacity building and community development professionals empower individuals and communities through skill acquisition, education, and self-sufficiency program. Crisis intervention. Uh, Social work professionals respond to disaster, economic crisis, health pandemics. Example, roles of professionals during COVID-19 to distribute food relief, healthcare services. Thus, social work as a field bridge theory and practice, training professionals to address complex societal issues. I'll take a break here for just 1 minute to take water. Bye bye. I'm back. So we explained fully the comprehensive social welfare policy needs to philosophy, mission, strategic goal, give suggestion on making social welfare policy more effective in Nigeria. Importance of philosophy, mission, vision, strategic goal, and objectives in social welfare policy. First, philosophy. The policy philosophy defines the underlying values and beliefs about social welfare. It determines the principles that guide the decision-making action. Example, a philosophy based on equity ensures resources are distributed to the most vulnerable and it reaches everybody. So that leaving no one behind, making sure no one is left behind. That's when you have a philosophy based on uh, equity. So that explains why you need to have a philosophy when you are conducting a social welfare program. Mission. Mission provides the purpose and the reason for the existence of the policy. It states that it states what the policy needs to achieve. That's the reason for the mission. For example, to eradicate and promote social inclusion through targeted supports to vulnerable groups. So here we want to eradicate poverty, which is the mission, and promote social inclusion and targeted at a vulnerable group. So even inside here, you can see the philosophy. The philosophy is to eradicate poverty and bring equality through targeting vulnerable groups. Vision describes the long-term goal, aspiration of policy. It provides roadmap for the future. So the difference between vision and mission is that mission provides the purpose and the reason for the existence of the policy, while the long-term goals the policy intends to achieve and the aspirations of the policy and the future where the policy wants to be in future and what it wants to achieve in future, that is the vision. So the difference is that purpose and reason for the existence of the policy is mission, and for vision, long-term goals and aspiration, and the roadmap to the future or for the future. A Nigeria where, example, a Nigeria where every citizen has access to quality healthcare, education, and economic uh, opportunities. So you see a Nigeria where, so they're thinking about the future, a Nigeria where, so that's the goals. The strategic goals. So strategic goals are specific, measurable outcomes that the policy aims to achieve within a period of time. They guide actions and resource allocation. Reducing poverty by 30% within 5 years through targeted intervention. This is a strategic goal. So let's move down. Objectives. Objectives are actionable, short term, different from vision. You see, vision is long term, while the objectives are short term to achieve strategic goal. They provide measurable milestone, increase healthcare services to 10 million Nigerians, provide skill acquisition for 1 million unemployed youth annually. So suggestions on making social welfare policies more effective in Nigeria. Let's look at this subtopic. This subtopic. Evidence-based programs. Evidence-based policy design. Policy should be based on data research to address specific social problem. Suggestion on making social policy more effective in Nigeria. So it should be evidence-based. Clear monitor and evaluation. Policies should include mechanisms that monitor and implement the implementation and evaluate their impact regularly. Policies should include mechanisms to monitor implementation and evaluate their impact regularly. So inclusive policy formulation, policymakers should involve stakeholders including NGOs, community, vulnerable populations to design inclusive and relevant policy. Adequate funding and resources. Government should prioritize social policy programs in the budget to ensure proper implementation, increasing the share for education and health in Nigeria's annual budget. That's an example. Public-private partnership, collaboration with private organizations to enhance funding, infrastructure, and service delivery. Targeted programs. Social welfare should focus on vulnerable groups such as rural population, women, children, and unemployed uh, people. These are things that should help make social welfare policy effective. If uh, if I'm right, yeah, effective in Nigeria. Yeah. So eliminate corruption and inefficiency. Transparent mechanisms should be put in place to prevent corruption and mismanagement of public funds. Uh, Adopt technology for service delivery. Digital platforms can improve accessibility and efficiency of social welfare programs. Using technology, for example, for cash transfer disbursement to avoid middlemen. Yeah, so this is it, like using mobile apps and other things directly. Adapt technology and service deliveries. Social awareness and education. Government should educate citizens about the available welfare programs and how to access them, like the loan for education loan. So frequent adverts and ads should be put on how to access them. It shouldn't be shady, it shouldn't become a secret. Government should educate citizens about the welfare of availability of these programs and also how to access them. By implementing this suggestion, Nigeria can develop and sustain effective social welfare policy and address poverty, inequality, and social justice. The current grave economic situation, especially with its high inflation, have never been that serious. Discuss the implication of this statement in the light of welfare needs of Nigerians and the need of effective policy to handle poverty. Implication of economic situation and high inflation on welfare needs of Nigeria. Increased poverty level. Inflation will increase poverty level. Inflation reduces the purchasing power of individuals, causing essential goods such as food, healthcare, and education to become unaffordable. This has pushed many Nigerians into poverty. Example, the rising prices of staples like rice and bread effectively that affects low-income families who spend majority of their earnings on food. So unemployment and underemployment. So economic hardship escalates job losses and reduces opportunities for meaningful employment. Many Nigerians are forced into informal and low-paying job. Example, the closure of small and medium scale businesses due to high operating costs and low demands. Food insecurity and malnutrition and inflation causes sharp rise in foods, leading to hunger, malnutrition, especially among children and vulnerable population. Example, UNICEF reported increased malnutrition rates in northern Nigeria due to food scarcity and hardship. 4. Strain in healthcare services. The rising medical cost. Many Nigerians cannot afford healthcare, leading to deteriorating health conditions and increased mortality rates. Education crisis. Parents are unable to afford school fees, uniform, learning materials, leading to higher dropout rates, especially in the rural area. Public schools enrollment, as for example, has decreased due to inability to cover basic education costs. Need for effective policy to handle poverty. This is another question. 1. Targeted poverty alleviation programs. Policies such as conditional cash transfers, subsidized food programs, and initiatives can cushion the impact of inflation. So they should be special. So, example, expanding the NSIP program to provide National Social Investment Program to provide direct support to low-income families, targeted poverty alleviation programs. 2. Control inflation through economic stabilization measures. Government should government should implement policies to stabilize prices, such as agricultural subsidies, reducing import duties on agriculture, health, and education, increasing domestic production of essential goods by supporting those sectors to grow. Um, Improved healthcare access, expanding national health insurance scheme to coverage of vulnerable population ensures access to affordable healthcare. So, number 4, we have job creation and skill development. We talked about underemployment and underemployment and unemployment. So policies like this should focus on creating employment opportunities through industrialization and supporting small and medium scale sized enterprise. Example, uh, skill acquisition program for unemployed youth to foster or to improve entrepreneurship. Strengthen social safety nets. Comprehensive social welfare policies must ensure vulnerable groups receive financial and material support during economic crisis. This will help improve the social safety nets. Education support programs. Policies that subsidize education for children from low families will prevent long-term cycle of poverty caused by education. By addressing these areas, effective policies can mitigate the severe implications of inflation and meet the needs of Nigerians and create a pathway for economic stability and poverty reduction and long-term recovery. Number 4, examine many challenges of social welfare policy formulation, implementation in Nigeria, and give cognizant suggestion on how to make sound, effective policy. First, we talk about the challenges. Second, we talk about implementation, and lastly, we talk about the suggestions of sound, effective policy. Challenges of social welfare population and implementation in Nigeria. Lack of accurate data. This is not new. Formulation policies without reliable data on poverty levels, unemployment, and welfare needs leads to ineffective programs. Corruption and mismanagement. Corruption and mismanagement. So misappropriation of funds, allocation of social welfare reduces the impact of policy. Examples, reports of embezzlement in cash transfer programs. Inadequate funding, budgetary allocations for social welfare often insufficient, leading to incomplete and poorly implemented programs. Social welfare policies, reports of embezzlement and cash transfer, corruption and mismanagement, inadequate funding, budget allocations for social welfare are often insufficient, leading to incomplete and poorly implemented programs. Inadequate funding. So when there's no proper budget allocations, usually insufficient and leads to incomplete and poor implemented programs. Uh, Political interference, social welfare policies are often influenced by political agendas which undermine their effectiveness and sustainability. So we should make sure that minimal political interference, fragmentation of programs, overlapping and poorly coordinated programs at federal, state, and local government cause duplication of effort and resource wastage. So one of the things you should avoid for that are the challenges of implementing social welfare policies, wastage. Poor policy monitoring and evaluation, weak systems for monitoring policy implementation. It's difficult to measure progress and make sure and makes necessary adjustment. Seven, lack of public awareness. Many beneficiaries are unaware of existing programs due to poor communication and outreach. So this is the work of National Orientation Agency and Ministry of Information. It will help uh, make citizens aware of the existing programs and how to assess them. Number eight, infrastructural deficit. Inadequate infrastructure such as healthcare facilities, schools, roads hinder delivery of social welfare. So suggestion to sound and effective social welfare. The first one we talk about the challenges. When you have accurate data and needs assessment, government knows what they should do. They've conducted regular surveys to gather data. So poverty, unemployment, vulnerable population for evidence-based policy making. So when you conduct regular surveys and gather out the data, government knows exactly what to handle, if it's health, if it's education, if it's power, which in every area what they are lacking, every local government, every state what they are lacking and where to concentrate on. Increase budgetary allocation. Social welfare programs should be prioritized in annual budget, ensuring adequate funding for implementation. Anti-corruption mechanism, transparency and transparent process and accountability framework should be put in place to prevent corruption. Example, independent auditing of funds allocated to social programs. Four, stakeholder engagement. Policy makers should involve stakeholders such as NGO, community leaders, beneficiaries in the design and implementation of programs. Integration and coordination of programs, where social welfare initiatives should be streamlined across all levels of government to prevent duplication and ensure resource efficiency to avoid resource wastage. Improve monitoring and evaluation. Establish strong monitoring mechanisms to assess policy impact and make necessary adjustments. Seven, public awareness campaigns. Yes, we talked about this. Government should use media, social media, grassroots campaign to inform citizens about available program, how to assess the infrastructure development. Infrastructural development, investment in education, healthcare, rural will ensure effective delivery of service. By implementing these suggestions, Nigeria can overcome existing challenges and create impactful and sustainable social welfare. I've been very fast, so I'm on the last question, which is social economic development are twin factors that are inseparable in social welfare policy and development. Examine their reciprocal and symbiotic relationship in the drive to improve welfare development generally. First, we talk about social and economic development, reciprocal and symbiotic relationship. Economic development drives social welfare. This is very easy to understand. And when the economy grows, it provides resources and revenue for needed to fund social welfare programs. So economic development drives social welfare. When the economy flourishes, government can invest in healthcare, education, and social protection. Example, increased government revenue in oil from oil exports can be used to finance poverty alleviation programs, training scheme, education, health, and other things in Nigeria. So, two, excuse me, social development, excuse me, social development enhances economic growth. So, you see, the first one we talked about is economic development enhances social welfare. Economic development drives social welfare. Here, social development enhances economic growth. Improving social welfare, such as education and health, increases human capital and productivity and economic output. An example, an educated and healthy population will be more innovative, productive, and contribute to national growth. That is that. Mutual dependence. Economic policies aimed in creating jobs and reduce poverty rely on social development policies, such like acquisition of programs and health access. For example, empowering unemployed youth through vocational training boosts economic activities and reduces social problems. So both of them also mutually depend on each other. They go hand in hand. Breaking the poverty cycle. Social welfare policies provide safety nets for vulnerable population, enable them to participate in economic activities, improve their living standard. For example, conditional cash transfer programs help poor families afford education, leading to long-term economic benefits. Equitable resource distribution. So when social development policies ensure that economic gains are distributed fairly and all social classes, reducing inequality and promoting social cohesion. Six, reliance on economic shock. Resilience to economic shock. A strong social welfare system protects individuals from economic downturns and enabling economic stability. A great example is that the inflation we're facing now in Nigeria and the removal of subsidy, the effect. If there was a good social welfare system, money will be pumped into social welfare system from the savings of the subsidy to help increase the safety net of the people, of the population. So resilience to economic shock. So this ends the section on social and economic development, reciprocal and symbiotic relationship. Now we'll be moving to how to leverage this relationship for improved development. Of course, this relationship will help. Number one, integrated policy approach. Policy should address both economic and social welfare to ensure inclusive development. When you put two of them together, when they are mutually dependent, and you add two of them together, so you can use them to integrated. Two of them can help welfare development when you integrate two of them. Investment in human capital. Government should prioritize education, healthcare, and skill development to create productive workforce. Promotion of economic opportunities, like creating jobs, support SME, improving infrastructure will complement social welfare initiative. Social safety nets, programs like unemployment benefit, pension, free healthcare protects vulnerable population during hardship and economic downturns. We have public-private partnership, collaboration between the government and the private sectors can mobilize resources for social development. By aligning this social and economic policy, government can foster sustainable development that improves quality of life for citizens while driving economic growth. Under public-private partnership, if I go back to number five, you see that some private organizations used to make donations to government, used to help hospitals, help vulnerable children, but they might not want to do it on their own because they do not have a social welfare department or a foundation that does it for them. We know MTN has a foundation that does theirs for them. Dangote has a foundation, but some other smaller private companies might decide to just partner with a government agency and fund that government agency to carry out certain programs or projects. Thank you.